Now, if you compare the refractive period of the cardiac muscle fibers with the skeletal muscle fibers, obviously because of the presence of this plateau, because of the presence of this, since the duration of the action potential is prolonged, you know, the duration of the action potential in the skeletal muscle fibers where it's just a few millisecond, like 5 or 10 millisecond, okay. But because of the very presence of this phase 2, because of the presence of the slow calcium channels, you know, slow calcium channels are not present in the skeletal muscles, so they do not have this plateau phase. But since the presence of the L-type slow calcium channels in the cardiac muscle fibers, this phase 2 is produced, which prolongs this action potential, which prolongs this depolarization. So it is also prolonging the refractive period. So the refractive period of the cardiac muscle fibers is much longer than the skeletal muscle fibers, and that we will inshallah see in the next few slides. So this is the absolute refractive period. This is the absolute refractive period, as you can see in this diagram, and this little one is the relative refractive period, okay, relative. So the distal half or the second half of the phase 3 is the relative refractive period, while the first half of the phase 3 is included in the absolute refractive period. Now this refractive period is because of the fact that during this period the sodium channels are inactivated. As you can see, you know, the phase 0 is because of the opening of the fast sodium channels, and then they are closed here at this peak. So when they are closed, their inactivation gates are closed. These are the inactivation gates of the sodium. You know, the sodium channels, fast sodium channels, the voltage gated sodium have got two gates, one on the outside and one on the inside. These are the activation gates on the outside, and these are the inactivation gates. These are the inactivation gates on the inside. So at the peak of this spike, okay, at the very peak of this spike, what happens that these inactivation gates are closed, and these inactivation gates are not going to get open unless the membrane potential become -90. So at -90, these inactivation gates are open while the activation gates are closed, and now they are ready to become activated again. So during this period, the muscle fibers is refractory to re-stimulation. It is because of the inactivation of these voltage gated sodium channels. This is the reason for that, okay. So I